MedStar Laboratory is one of the oldest and largest independent clinical laboratories in the state of Illinois. MedStar Laboratory is a minority-owned corporation that provides state-of-the-art clinical laboratory service since 1974. We currently service over 800 medical facilities, including hospitals, nursing homes, assisted living facilities.
MedStar's Toxicology Division, Soft Landing Labs, is a leader in drug testing and specializes in servicing behavioral health centers. We pride ourselves in diversity, where 33% of the lab is owned by a minority woman and 80% of the workforce is women. MedStar Laboratory is known for its accuracy, proficiency, customer service, and dependable delivery of quality services by qualified professionals.
We provide personalized service around the clock 24 hours a day with professionalism at its best. Thanks to you, we are growing and offering a comprehensive range of diagnostic testing. MedStar, your partner for progress and longevity.
Hello and welcome to Dr. VGP TALK SHOW that reaches 42 million households, including 2 million households across Chicagoland. We are here today at the Family Guidance Center, which is the #1 medication-assisted recovery program in the whole state of Illinois. Family Guidance Center is started in late 60s with a 50 million annual budget and today has 400 staff with serving a clientele of over 4,000. We are at the headquarters at 2630 South Wabash Avenue in Chicagoland. We have with us today our guest, the brains, the nucleus behind the #1 medicated treatment program center in the whole state of Illinois, the Family Guidance Center. None other than the dynamic, debonair Ron Vlasaty Jr., the Chief Operating Officer of Family Guidance Center.
Thank you.
Thank you so much, Ron, for joining us today. It has been so tough to get hold of Ron Vlasaty. Chief, thank you for giving us time today. I know you're always focused, driven, and passionate about bringing the state-of-art services to the citizens of Chicagoland. We are so fortunate that you are today heading this organization and been with the organization for the last 26 years. You have made Family Guidance Center today as one of the top behavioral healthcare organizations that excels to promote the well-being of individuals, families, and communities through prevention and education.
Yes.
You know, I often wonder when icons like you, what has made you be what you are today and what you're doing to transforming society? I would just like to take a look back and see about your childhood, talk about your parents, your lineage. I know that you were born and brought up in the melting pot of Chicago, then the market space, 6700 and Kedzie, and you were born to Czech immigrants, and that time you belonged to the Czech American community. It's wonderful to hear and have our viewers hear about your early childhood and your education, Ron.
Thank you. I had a wonderful early childhood. My mother and father were very family oriented, and my brother and I had a very good life. We didn't desire for anything. My mother and father provided all of us with the basics and provided us a good living and a comfortable living, and it allowed us to focus on what we wanted to be when we grow up.
That's great. You had a family-oriented childhood. Tell us about your early education. What prepared you for the role that you are in today?
My mother and father were strong and strict Catholics, so both my brother and I were born and raised and schooled in Catholic education, Catholic grade school. I went on to a Catholic high school, St. Rita High School on the south side of Chicago, and then to the University of Illinois. But it was always the Catholic religion that was the driver behind us.
While you were in college and school, I think you were a good football player. Tell us about some of the escapades.
I actually played sports in high school. I never got to play sports in college, but in high school I played basketball, baseball, and football, and I excelled in several sports, but not good enough to make it to the next level. But I had a lot of fun, and again, playing sports in a Catholic school, it was all about teamwork and camaraderie and
competition, I'm so.
Very much competition. So we were very well driven. Our coaches were definite motivators and really put us on the road to where we are today.
So I would take it that in the early 50s and 60s, the private Catholic schools then in Chicagoland, what did your youngsters do to hang out after school hours?
So I went to an all-boys school. So back in the day, the schools were segregated between girls and boys. I went to an all-boys school, and I played sports all the time. So all the practices were after school. But on the weekends, we'd play sports. Days off, we'd play sports. Everything was all motivated and generated around sports.
Very interesting. See, I think that's what's lacking in today's youth and educational system. After school what? And I'm very glad to hear that those days that you all engage fully in sports, and it's sports and again sports.
Right.
I mean, I think that's what is a well-grounded studies at school and sports afterwards, and that gave your brain and mind and body a great focus. And I think that's what we should try to inculcate in today's educational system.
I agree 100%.
Now, tell us about your early career, Chief.
When I graduated college in 1981, my first full-time employment was with the Cook County Adult Probation Office. I was a Cook County Adult Probation Officer, and I spent about 8 years with that job. And that was a job helping individuals who had been convicted in the criminal courts of Cook County and placed on probation, and I was the probation officer to at least over 200 individuals that were on probation. So that was my first attempt to begin to start helping people and shaping people and molding people to live more productive and healthier lives.
I mean, that's a great start where you're trying to give a second chance to those prisoners by being a probation officer, listening, counseling. I think that's what grounded you and your dynamic foundation to what you're doing today.
That's correct.
Tell us about your stint with the state of Illinois.
After I left the county probation, I went to work for the state of Illinois. At the time, it was called the Department of Alcoholism and Substance Abuse. And the motivation there was to get in on the ground level to help the state create a substance abuse treatment system statewide with the governance and rules and regulations of a state department. So that was my first experience with government work, government contracting, and I began to develop in a leadership role from that job.
Great. How long were you with the state?
I was with the state about 14 years.
Wow, wow, wow. Here we have Mr. Ron Vlasaty Jr., the Chief Operating Officer of Family Guidance Center, had 8 years as a Cook County probation officer, and then 14 years when the state of Illinois was setting up DASA. It was known as the Department of Alcoholism and Substance Abuse. The acronym was DASA. We were all very familiar at that time with DASA. And mental health and behavioral health in the late 70s and 80s was unheard of.
That's correct.
And today, tell us, you have been set with such a strong career background. How did you evolve Family Guidance Center to where it is today? Explain to our viewers, when you started 26 years ago, what was Family Guidance Centers? What is Family Guidance Centers doing today through its 10 centers?
Well, with the help of some other individuals, I can't take all the credit for it. Obviously, our president, Dr. Larry Kroll, myself and the other leaders in the company. When I got to Family Guidance Centers about 26 years ago, 25 years ago, we had about 3 locations. We had about 400 patients, and we had a budget of about $3.5 million. Today, as you've mentioned before, we have 10 centers, 10 full-fledged centers, 400 employees, and close to $50 million in an operating budget. So we have grown substantially over the past 26 years, and part of that was to address the different public health crises that our country and our state have undergone. Most recently, the terrible opioid epidemic that really got full public attention about 2017.
Now, what does the Family Guidance Centers do and serve on a daily basis?
So Family Guidance Centers is a non-for-profit behavioral health care company that specializes in substance use disorders and mental health treatment, with a specialty or an adjunct to treatment called medication-assisted treatment or medication-assisted recovery. And the gold standard in the country today is that individuals that have an opioid use disorder, using medications to help their treatment, medications such as methadone, buprenorphine, and injectable naltrexone, are now the gold standards to address the opioid use disorder. But it can't be just with medication alone. It has to be with therapy and counseling provided and recovery support services.
Wonderful. From 3 locations, $3.5 million budget, to today where we have 10 locations and a budget of $50 million, isn't it an incredible story of success? What is the philosophy and vision of Family Guidance Center?
Well, there's a couple of things. Number one, it's our mission is obviously to treat and prevent substance use disorders and mental health problems in individuals. But underlying under that mission, our real goal and our real driver is immediate access to care. That is setting up programs and locations and policies and procedures and internal operations that allow individuals to access treatment the day they call. The day they decide that they want to make a change in their life, we need to be there for them. So we've designed all of our programming and all of our operations around one general principle, and that is immediate access to care. Same day service. If you can't come in today, can you come in tomorrow? If you can't get here, we'll come and pick you up. And that's our philosophy statewide.
Well, very well said, Ron. Now, immediate access to healthcare, do you think the barriers to that are some social determinants of health?
Yes. A multitude of barriers are presented to individuals. Obviously, we just got out of a pandemic that did not support individuals in need of services because of the social distancing and of the shutdowns and close-ups. Transportation is a definite barrier and a deterrent to health care. Ability of individuals to get from one place to the next. Although the city of Chicago and some larger cities have a very robust public health transportation, it doesn't stop in front of everybody's front door and pick them up. They still have to get to the train and get to the bus. The other thing is child care. Individuals that are suffering with mental health and substance use disorders often have children, and the lack of child care services in certain communities has been an absolute deterrent to their better health.
You just mentioned a very significant point, the lack of child care facilities. Do you think that mental health centers like you, if you open a daycare center as an additional service, would it be able to meet one of the challenges and improve the access to care?
We would love to do such, but it would have to probably be a standalone facility from our other adult locations with the residential services and some of the conflicts with in terms of services being provided. But we do believe that there are a lot of good community-based child care providers that we are partnering with.
Oh, excellent. Now, could you throw some light on the medicated assisted recovery and treatment programs. Are you specializing in methadone or Suboxone or the latest Narcan therapy, or how does it work for our viewers to understand that, and how
Sure.
can they access it?
So Family Guidance Centers has been traditionally a methadone-only provider. Back when we started, we were offering methadone. We were one of the first programs in the state of Illinois and in the country to receive Joint Commission accreditation, the same accreditation that hospitals receive. When the federal government started requiring it, Family Guidance Centers was a pilot site. So our specialty has been methadone over many, many, many years in addressing the opioid use disorders and the opioid epidemic. But most recently, with the studies and the proven fact that other medications such as buprenorphine or Suboxone and injectable naltrexone or Vivitrol are also gold standards in terms of treatment for opioid use disorders. So now Family Guidance Centers offers 3 forms of the FDA-approved medications.
Great. Now, what are some of the challenges of a medication treatment program, and also highlight some of the successes of the medication treatment program?
Well, one of the challenges is being able to retain patients. Patients that are suffering from opioid use disorders and are willing to start making a change in their life oftentimes have relapse issues and often do fall back and relapse again. And it's our responsibility to help them retain in care and in services. So we need to be there when individuals fall. We need to be there to pick them up and get them started again. We have a number of patients here that have fallen 4 and 5 times before they've really begun to work on their treatment and recovery. And we need to be there each and every time. We are not punitive, and we're not punishing individuals. We're accepting and we're welcoming individuals to come back into care. The other challenge that the entire field, the entire system has experienced is the workforce challenges. Coming out of the coronavirus pandemic, we've seen a whole different shift in the workforce from individuals who were willingly interested in getting into this field to right now we're having some difficulty with recruitment, and we're having difficulty getting individuals interested in taking on this field and coming to employment. And we're not alone. It's every behavioral health care provider in the country.
I think post-COVID, one of the major constraints for all, not only for you as behavioral and healthcare providers, I think it's across the board, the workforce crisis.
That's correct. It's
a
been difficult.
Very
We're
challenging.
starting to see it come around. We're starting to see it come out now. We're starting to hire more people. But I have to tell you, the workforce and their needs and wants is very different than prior to COVID. So there's a little bit more of a work from home type environment and atmosphere, and that doesn't work very well in a behavioral health care system.
That's true. Nothing like a person to person, especially when you're trying to treat a human life, trying to understand them and transform them.
That's correct.
Tell me you listed out all the challenges. What has been the success? Obviously, medicated assisted treatment and recovery is one of the most successful ways of getting them back on track.
But I don't think our success could have been possible without the federal and the state government being there to support, not only with funding, but with principles and concepts and rules and regulations, and relaxing and changing and making rules and regulations more flexible to allow individuals to better benefit from the services we provide. So kudos to the governments.
Thank you so much for pointing it out. It's the first time we're hearing something positive said about the federal government when they're combating the mental health crisis, that they are very flexible to listen to providers like you, to listen to the client's needs in bending the rules, changing the regulations to meet the challenges of the crisis.
That's correct.
The SAMHSA agency, SAMHSA, for the federal agency, is primarily overseeing this. And they have been very supportive, not only in funding, but you're saying regulatory aspect, which is very important and true.
Yes.
I think that what you just said, since this is a global program, we have people from other countries listening. I think the other countries should take a cue from what America is doing and what you said. In particular, how has the state of Illinois, have they been supportive two behavioral health and mental health programs?
Absolutely. So the first thing is they took a cue from the federal government and they allowed telemedicine to become a everyday practice. Now the telemedicine concept is really quite simple. It is actually breaking down those barriers that I talked about before. Those individuals that have trouble getting to the clinic, getting to come to receive services, for whatever reason it is, transportation, childcare issues, we are now able to provide services via telehealth over the telephone. We did surveys of our patients when we first started telehealth when the coronavirus became prominent, and a number of individuals, in the 90% to be exact, indicated a willingness and acceptance of telehealth services, and most of them commented that they actually felt more comfortable talking to a counselor over the phone in the comfort of their own environment.
Absolutely.
And so and again, the government's allowed that, so I applaud both the federal and the state government.
I mean,
that.
you have again hit upon a very poignant point which is being debated today. Is telemedicine the future of healthcare delivery?
Yes.
I mean, artificial intelligence is another
Yes.
topic we'll
We won't
come
go
to
there
it.
yet.
We won't go there yet, but I'm saying, but what percentage of clients, Chief, are on in-person and as opposed to telemedicine in your facility?
So I would say in terms of identification of a patient population that is coming in more frequent, it would be individuals who are just starting in treatment. We're just starting to engage with that individual. We're just starting to learn what their interests are, what their habits are, what their needs are. So we are bringing those people into the center more often. As individuals begin on their road to recovery and begin to be more comfortable, we're allowing them to come in less, and we're allowing us and them to communicate over the telephone. So it's not a trust, it's not a comfort level, it's a part of recovery in which individuals are beginning to make progressions to be allowed to not have to deal with all those barriers of getting to the clinic every day.
Talking about telehealth and telemedicine, how will the medications, how could they be delivered when they are, of course, counseling? The client is in the comfort of their own setting, yes, and they receive counseling. But how about the medication part of it?
So the federal government, again, has allowed us to give patients more take-home medications than they used to in the past. In allowing an individual to take more medications home with them doesn't require them to come in as frequent. And again, I applaud the federal government for that flexibility. We're taking full advantage of it at Family Guidance Centers. We rolled this out in July this year of extending flexibilities with take-home medications. We're beginning to study what those results are going to be. And we feel in a couple of months we'll be in a position to show some real positive results from that flexibility.
Talking about taking home more medications, we sometimes hear of stories that some of this methadone is sold on the street. And would that be a deterrent, or how does that, is that really just, what shall I say, an allegation? Does that happen, or only in a few cases? Or how?
So we think it's an old wives' tale. We think it's something. We think it's something that's been, methadone treatment's been stigmatized from day one of methadone treatment, and we believe the diversion of methadone is nothing more than an old wives' tale. We have seen it in our patients. We're also doing a program called remote observation, where individuals are actually videoing themselves taking their medication, wow, and sending that video to us to review.
Absolutely
and
great.
We're seeing positive results of individuals. Now, the other food for thought on the issue of diversion is we all know that illegal drugs are very plentiful in the streets of Chicago, in the state of Illinois, and in the country. And the need for diverted methadone is not as great as the need to acquire other illegal substances like heroin, unfortunately laced with fentanyl. So we're not seeing any evidence of those comments of serious diversion. Obviously, the federal government is either, because they've changed the rules to allow for more flexibility. So
I mean, you have said it very well, because like you said, it's an old wives' tale.
It is.
And I think the more people must listen to you to debunk those
Yes.
type of rumors and allegations and say how important is medication treatment to recovery.
Yes.
And you also said very candidly about the remote observation. I think today, America and especially the Family Guidance Center is way ahead of the game in the telemedicine delivery of healthcare, including giving medications. I think it's a great example because the way things are moving, population is exploding, the mental health crisis is growing larger, it's not coming, it's falling. I think that's one of the ways we can combat the challenges.
Yes.
And I would uphold you, Chief, to be a resource person, not only for the rest of America, but also the rest of the world, because they all have to learn from successful working models. Who better than you and Family Guidance Center can give them the expertise from grassroots experiences?
We do that every day. We've been more than willing to bring on additional individuals to learn. I mean, we've introduced 3 real innovative concepts. Innovative in our field. One of them is mobile services.
Yes.
It's bringing services to the community. So remember when I said about those people that have trouble getting to us?
Yes, yeah.
Well, let's go to them.
Correct.
So that was the first real innovative approach. And we have mobile vans in Chicago. We have one in Springfield. So we're getting medications out to the community. The other thing is obviously the immediate access to care. I think people need to learn about opening up their doors and changing their internal policies and procedures. So when somebody calls you, you get them in the same day or the next day. Because if they call and you schedule them to come in and see a counselor a week from Friday, one or two things is going to happen. Either they're going to overdose and die, or they're going to be in jail. And we've learned that from our past experience. When those people are interested, you got to get them in. That was the second thing. And the third thing, obviously, is that remote observation. Using innovative approaches that not only prove to be successful, but they're accepted by patients. They're accepted by the individuals you're serving. So this isn't regulatory and government and executives and organizations telling them what to do. This is patients having input and having suggestions how we can do this better. We've learned a lot from patients over the years.
You have said it so well, and I think that's the core success of Family Guidance Center, and I think we should be able to share this. I know you're a very busy person, but I would like to, I have been receiving calls from health ministers from third world countries about telemedicine. And we are planning a telemedicine gig with the Chicago Medical Society shortly. I would like you to come and share, and even they could tour your facility if it's okay
I'd be
with
happy
you
to
share, because I think we can grow only by sharing experiences.
Yes.
And it's not restricted to one location. We should have a global outlook today when we are facing the
No
mental
doubt.
health. That brings us to, let's have a candid, you talked about legal drugs on the street, illegal drugs on the street. Give me a candid comment and a candid conversation about what is happening on the streets of Chicago today. Why is the mental health crisis deepening? Why is gun violence increasing?
Well, first of all, and we all know this, everybody came out of the pandemic a little worse off. The isolation, the people losing jobs, losing their social environments, and their ability to communicate and sit down with their friends in a room and have conversations. I think that all led to a definite upscale mental health crisis. Those people now coming out of isolation, unemployed, they lost their job during the pandemic, or working from home, and that no longer is a privilege that's allowed. So they have to come back to the office. So that adjustment with the child care and the schooling and all of that, we just keep adding pressures on people of doing the right thing and giving them all kinds of directions of doing the right thing. And we're not just listening to these people and listening to the communities for them to say, well, this is what we need. I think the biggest thing is accessing all kinds of care in the community. We know there's numerous communities in the Chicago area and in the state of Illinois, especially in rural areas, where primary care is not immediately accessible. There isn't a doctor close by. There isn't a hospital close by. There isn't a behavioral health care provider close by. let's start to talk about how we can provide a large amount of services to a large amount of people that aren't in our building every day. Telemedicine.
Great. Telemedicine is the future, is the present as is being delivered by Family Guidance Center. You brought out a very important point about access to primary care. Recently, you, Family Guidance Center, was part of an integrated medicine grant from the state of Illinois, which just says the same thing, bringing together primary medicine, behavioral health care, and the other social determinants. Could you quickly, for our viewers, tell us what that grant is about and how is it being implemented today?
Sure. Well, there's one of two ways to look at integrated care. And the integrated care, you could do it all by yourself, okay? Or you can identify a partner that's doing a part of it. Family Guidance Centers doesn't want to be in the primary care business.
Absolutely.
We're not a primary care provider. So we identified with a primary care provider who, like us, didn't want to do behavioral health and didn't want to do methadone. And that provider and us, we came together and designed an integrated care model that we are now taking to additional institutions and additional hospitals. Because at the end of the day, those hospitals are looking for somebody to help with all those patients that show up in the emergency room with an opioid use disorder. And we're looking for medical providers to care for the individuals that have an opioid use disorder, but also have primary care needs.
Now, that grant from the state of Illinois in round one was 100 million, 150 million for the whole group of integrated approach.
Oh, there was, I don't know what the exact amount was, but I know that Family Guidance Service was awarded some of that money. To implement a program.
Chief, thank you for enlightening us on the multifaceted approach what Family Guidance Center is doing today to meet the challenges of the mental health crisis. You have set an example with telehealth. From here, where do you go? Where's the next step?
Well, we have to expand mobile health units. We have to get more mobile units out to the communities. Those mobile units need to be equipped with harm reduction tools, Narcan, fentanyl test strips, xylazine test strips. We need to have more safe consumption sites where individuals can go in the community, use their drugs, but also have the availability of nurses and doctors and counselors on site there, if in fact they're willing to begin treatment. So it's those kind of innovative approaches that we need to expand upon and we need to grow for the future.
You have, I think you have raised a very controversial part when you said safe consumption sites. You are telling us that you want to provide a safe site where individuals can go and consume drugs, but with opium and opioid becoming legal marijuana become legal in the state of Illinois, but they should have some medical care on hand in case they overdose to prevent deaths. And especially with the fentanyl overdose crisis. Could you give us a word on that, what's happening there and how Narcan can, you said about fentanyl test strips, I think you said harm reduction. And I heard somewhere you mentioned State Representative Rashawn Ford, and I believe that Family Guidance Center is going to be the first in the state of Illinois to roll out vending machines with Narcan. Could you throw some light on that?
Yeah,
That's exciting.
Yes, so there's communities that are in need of Narcan, and Narcan is the tool that's used to reverse an opioid overdose.
Correct.
And communities are in need of having access to Narcan, and there are other places around the country. There are other kinds of different designs of this, but our thought process with some private sponsorship and with Representative Ford and the community was to place vending machines in strategic locations, especially on the west side of Chicago, where the opioid overdose rates continue to rise, to allow the community to have immediate access to free Narcan.
My God, this is exciting, revolutionizing news how Family Guidance Center and Ron Vlasaty Jr., the Chief Operating Officer, along with elected officials and private vendors are going to change the way mental health crisis is being treated today. You're going to introduce this concept of having a free vending machine with Narcan, which is an opioid reversing medication available, and also the idea of setting up safe consumption sites. I mean, this is revolutionizing what healthcare delivery is today. I salute you, Ron Vlasaty Jr., and we are sure we're going to hear and progress, and this is going to be broadcasted across the world, and again reinforcing telemedicine. It's a very enlightening interview. You are doing so much, and I would like to have, before we conclude this interview, insight and present about what your free time, passion, and hobbies do. Do you get any free time while you're dealing with changing people's lives, saving lives, I could really say, and managing 10 centers and overseeing 400 employees, a $50 million budget, and serving 4,000 clients with still such vibrant, creative ideas put into action to change the way mental health is going to be practiced today?
Well, let me first say that we don't get here, Family Guidance does not get here, and we talked about the support from the government, without the high class of individuals that work at Family Guidance Centers. The doctors, the nurses, the counselors, the support staff, the recovery support specialists. Because you can come up with any idea in the world to be creative and innovative, and if you don't have the staff that also have those same beliefs, that idea and concept isn't going to go anywhere. So I want to commend everybody that works for Family Guidance Centers on a marvelous job, loyalty and dedication, not just to Family Guidance Centers, but to the patients they serve. And we're excited to move forward and to bring more people on board.
I would second that absolutely, Ron, because even your security guard at the entrance of the building is so welcoming. And that's so important, because when you talked about the challenges to access of healthcare and the stigma regarding methadone and mental health, that's the first thing, the first person you see should be welcoming.
Yes.
And that gives the client, and not only us, a feeling of welcome, sense of security that we can come and trust, which is so important in healthcare delivery. And I has always said, like you rightly said, a leader is as strong as his team.
Yes.
And I'm so happy that you pointed out that your employees are as good as what Family Guidance Center stands for. It's very important for a successful operation.
It is.
I would like to ask you about your hobbies and passion and how you balance your wonderful busy, hectic, successful, proven lifestyle along with what you do.
So interestingly enough, my hobbies seem to be my grandchildren.
Oh, good.
So again, being brought up with a very, very in a very family-oriented environment, I take a lot of pride and a lot of interest in, when I do have the time, in my grandchildren, and my children as well, but my grandchildren, to make sure that everything is going well and that my wife and I are being supportive of our children and our grandchildren. So I think that's most of my free time is spent doing things like that.
At the end of the day, you see a successful executive who's transforming lives gives importance to family. And again we hear that family is very important. And his hobby and passion is spending time, whenever he finds time, with his lovely grandchildren. On a concluding note, Chief Ron Vlasaty, if you have given an opportunity to take 3 people out for dinner, it could be from the past or present, who would those 3 people be?
Wow, that's a really great question. So, we got to change the stigma around substance use and mental health disorders. So I would like to take out individuals who really have an influence in the community, whether that be a sports figure, a politician, a community activist, anybody. I can't think of any one person. Maybe Michael Jordan, because I think Michael Jordan could address all those different audiences.
Absolutely.
But identify people that really could make a change and can help us get over this stigma and bring back to their communities, whatever that community is, the message that it's okay for people to come forward and say they need some help. And it's okay for a provider like us to be in their community offering that help.
Very well said, Chief. Could you give a parting message to all your viewers, or whatever you want to tell them about the importance of mental health, the importance of taking care of themselves? It's all yours.
So I think it's really important to not feel bad and feel good and feel open that if in fact you are suffering from either a substance use disorder or a mental health issue, that you come forward and seek help immediately. There are plenty of class organizations in the community and all across the country and all across the world that their mission is just like Family Guidance Center, and that's to treat individuals, to treat them individually and to get them into care as soon as we can. So again, parting note, come forward, ask for help, and we'll be there for the assistance.
You see, scrolling down the screen, you'll have the 1-800 number of Family Guidance Center, which any of you can access, as it's important. We just heard such a wonderful, inspiring conversation with the Ron Vlasaty Jr. himself. We took about a year to get this interview, my friends, believe it or not, and because he believes in focus-driven work ethic, and he has talked to us candidly about the problems the society is facing on mental health crisis. He talked about the future. He talked about the future of mental health, which he is implementing. On August 31st, he's talking about harm reduction. He's talking about safe consumption sites. We have not heard this revolutionary approach to mental health crisis, that where you could have a free vending machine where Narcan, an anti-opioid or an opioid reversal medication, will be available free to those who need it, could take home and use it. You can consume drugs. You know, marijuana is legal in the state of Illinois and several other states in America. But Ron Vlasaty and Family Guidance Center is going to open safe consumption drugs where you can consume a drug which has within the same facility medical help on hand. So there will not be any overdose. The overdose could be prevented. And the fentanyl overdose crisis, which has caused several thousand deaths across America, this is a practical, creative approach to combat it. The first time I heard it. Thank you so much, Ron G, for joining us, and it's been wonderful.
Thank you for having me.
And thank you so much for the time. And we're going to look forward and again reiterate your commitment to telehealth, which is so important, my friends, today, and the safe conception sites and the harm reduction. Thank you so much.
Thank you.
Thank you so much.
Thank you.
MedStar Laboratory is one of the oldest and largest independent clinical laboratories in the state of Illinois. MedStar Laboratory is a minority-owned corporation that provides state-of-the-art clinical laboratory service since 1974. We currently service over 800 medical facilities, including hospitals, nursing homes, assisted living facilities.
MedStar's Toxicology Division, Soft Landing Labs, is the leader in drug testing and specializes in servicing behavioral health centers. We pride ourselves in diversity, where 33% of the lab is owned by a minority woman and 80% of the workforce is women. MedStar Laboratory is known for its accuracy, proficiency, customer service, and dependable delivery of quality services by qualified professionals.
We provide personalized service around the clock, 24 hours a day, with professionalism at its best. Thanks to you, we are growing and offering a comprehensive range of diagnostic testing. MedStar, your partner for progress and longevity.